Nowadays, social media and morning shows always promote a good diet and low-fat foods as a means of preventing heart attacks and other heart diseases. And today's situation is no different from the past when it was believed that heart disease and clogged arteries were also a gift of aging. It has nothing to do with diet and your lifestyle. But in the meantime, a critical turning point comes in the history of medical science and the whole direction of understanding and thinking about heart disease is changed. This event was at the height of World War II when Britain was engaged in a massive war against Hitler's Germany. Since Britain was the protagonist of the war in those days, its entire tax collection was devoted to war and defense activities. During this period, scientific and medical research was negligible as the Treasury had insufficient money for progressive projects. In view of all this situation, a British scientist, Jerry Morris, thought of conducting a unique research, which cost less, but the results were marvelous. His basic idea was that lack of exercise causes heart disease and heart attack, so he chose a unique laboratory for this work. Double-decker buses were very common in London in those days, and Dr. Morris's laboratory was going to change the course of history. Dr. Morris observed that because a bus driver is glued to the driver's seat all day and can't leave the seat even if he wants to, almost the entire day is affected by his lack of activity level. So the bus driver can be taken as a sample, which we can look at as a lack of motion model. Now he wanted a person who was more active than the driver. For this, Dr. Morris made another excellent choice, and that was the conductor of the same bus. Yes, the conductor and driver are seen in two different ways while on the same bus. The conductor walks back and forth in the bus all day to collect the fare, and as soon as a new rider boards, he has to attend to him. Similarly, he was responsible for loading and unloading passengers at each stop. In this way, each conductor walked an average of 600 steps in each shift. Meanwhile, the driver does not even feel the need to move from his driving seat. Therefore, this double-decker bus was a perfect laboratory. With a low budget, Dr. Jerry Morris selected 35,000 drivers and conductors from across the city and its suburbs to conduct this research on a large scale. In the process, to collect some detailed information about their health as: how old are they? In what environment do they live? Are they fat or thin, etc.? To obtain this data, the Medical Research Institute contacted the offices of these buses and made an agreement with them to keep the research team informed about the health of their employees and their absence from duty due to illness. This research lasted for almost 2 years and ended in 1942, but its results surprised everyone. Dr. Morris writes that drivers, no matter how healthy they were or how well they ate, had twice the heart attack rate of conductors over 2 years of time. In 1 year, 82 deaths were noted that were due to heart attack or vascular disease. This was the first time in history that anyone had examined the direct connection between exercise and health. A scientific effort gave a new direction to the world's thinking that exercise and a healthy lifestyle are closely related. You cannot avoid a heart attack simply by adopting a good diet and good hygiene. For this, you have to be proactive. This matter remains the same today despite the passage of 80 years. After the research of Dr. Morris, new researches were conducting in this direction every day, and this idea was further strengthened. It was proved that if you do some kind of exercise or go for a walk every day, you will not have a heart attack. The chances of occurrence can be reduced by 31%.